The ketogenic diet is one of the latest fad diets that promises fast weight loss. Celebrities such as Kim Kardashian and Rihanna have promoted the keto diet as an easy and fast way to lose weight. However, risks are usually not mentioned by the media when reporting on this diet. Could a ketogenic diet have a negative or even deadly impact on one's health? In this report, I aim to explore this topic and answer the question, does the ketogenic diet increase a person's risk of developing cardiovascular disease? Unlike other low-carb diets, the ketogenic diet emphasizes eating high amounts of fat. A ketogenic diet plan centers on 90% of daily calories coming from fat. The goal of the keto diet is to make your body use ketones from fat for energy instead of relying on glucose from sugar. Most cells in the body prefer to use blood sugar, which comes from carbohydrates, as the body's main source of energy. In the absence of circulating blood sugar from food, we start breaking down stored fat from molecules called ketone bodies, and this process is called ketosis. Once you reach ketosis, most cells will use ketone bodies to generate energy until we start eating carbohydrates again. Although this may seem easy, in order for your liver to make ketone bodies, you must deprive yourself of carbohydrates by eating less than 20 to 50 grams of carbohydrates in a day. In order to achieve such a high intake of fat, dieters are encouraged to eat saturated fats from oils. We have solid evidence showing that a ketogenic diet reduces seizures in children. Because of this neuroprotective effect, questions have been raised about the possible benefits for other brain disorders such as Parkinson's, Alzheimer's, autism, and even brain cancer. However, there are no human studies to support recommending ketosis to treat these conditions. Cardiovascular disease is the leading cause of death worldwide. Diseases of the cardiac muscle and vascular system supplying the heart, brain, and other vital organs fall under the category of cardiovascular disease. The term heart disease refers to several types of heart conditions. The most common type of heart disease in the United States is coronary artery disease, which affects the blood flow into the heart. Decreased blood flow can cause a heart attack, and sometimes heart attacks may be silent and not diagnosed until a person experiences signs or symptoms of a heart attack, heart failure, or arrhythmia. Major risks for developing cardiovascular disease include high tobacco and high alcohol use, high blood pressure, and lack of vegetables and fruits consumed. Although some risk factors such as age, ethnicity, gender, and genetic predisposition cannot be modified, most of the risk is attributed to lifestyle habits which can be altered. Genetic predisposition puts individuals at a higher risk for developing heart disease. However, lowering LDL and elevating HDL cholesterol is one of the main treatments of cardiovascular disease, and investigators suggest that suboptimal levels of cholesterol contribute to almost 2/3 of the global cardiovascular risk. In order to increase HDL and lower LDL cholesterol, it's recommended to eat foods high in soluble fiber, especially fruits and vegetables. The most dangerous part of the ketogenic diet is the amount of saturated fat that is consumed. The ketogenic diet is linked to an increased risk in LDL cholesterol, which is linked to heart disease. Saturated fat increases LDL cholesterol, which is a major cause of atherosclerosis and cardiovascular disease. The type of dietary fat, more than the total fat intake, is an important determinant of cardiovascular disease risk. We also don't know much about the long-term effects of the ketogenic diet because it's a hard diet to stick with and people can't do it for a long time. It's also important to remember that yo-yo diets that lead to rapid weight loss fluctuation are associated with increased mortality. According to the American Heart Association, in order to decrease the risk of cardiovascular disease, saturated fats from dairy and meats should be replaced with polysaturated and monosaturated fats from vegetable oils. Replacing saturated fat with polysaturated or monosaturated fat lowers blood triglyceride levels, which is an independent biomarker of risk of cardiovascular disease. Modifying the fat we eat protects us even better if we adhere in doing so for at least 2 years. Most dietary recommendations advise limiting saturated fat intake to 10%. However, this may not be enough. Eating a plant-based diet may be the solution to lower heart disease rates around the U.S. and around the world. The American Heart Association states that eating a plant-centered diet in young adulthood lowered the risk in middle age for heart attack, stroke, heart failure, and several other cardiovascular conditions. Instead of engaging in the next popular fad diet that'll only last a few weeks or a few months, and that includes the ketogenic diet, we should try to embrace changes that are sustainable over a long period of time. Eating plant-based foods that lower cholesterol levels reduced the risk of heart disease in postmenopausal women. According to the Harvard Medical School, those who eat a plant-based diet high in whole grains, vegetables, fruits, legumes, seeds, and healthy oils are least likely to suffer from heart disease and live a healthy, vibrant life.